introduce to you today Dental Surgical Instrument Kit. This kit is a universal winged implant instrument kit developed for mainstream implants currently available on the market, and is specifically designed for transweighing implant surgery. The instrument kit features a double-layered panel design consisting of upper and lower sections. First, let's introduce the upper layer, which consists of a manual straight wrench, winged implant positioner, bone spreader, screw holder, motorized screwdriver, adapter, and extender. Let's first look at the winged implant positioner. It has a relatively sharp tip, which helps us determine the implant site and direction during transweighing implant surgery. It can effectively control the initial insertion direction of the implant and complete the preparation of the bone channel. Next, let's look at these 4 bone spreaders. These 4 bone condensers correspond to different diameters. First rod, 2.0, 3.0 means its tip diameter is 2.0 millimeters, and the diameter of the base is 3.0 millimeters. Second root, 2.5, 3.5 indicates a tip diameter of 2.5 millimeters. The diameter of the bottom is 3.5 millimeters. Third root, 2.8, 4.0 indicates a tip diameter of 2.8 millimeters. The diameter of the bottom is 4.0 millimeters. Fourth root, 3.0, 4.5 indicates a tip diameter of 3.0 millimeters. The diameter of the bottom is 4.5 millimeters. How to use our bone spreader? When dealing with patients with osteoporotic bone, it may not be necessary to prepare with a twist drill, or after preparing with the first drill, directly use our bone condenser together with a straight handpiece. Once connection, perform stepwise bone expansion. This helps to preserve as much bone volume as possible in the maxillary tuberosity region, increases bone density, and effectively achieves tapping and shaping of the hard bone at the Sphenopalatine process, ultimately improving primary stability during implant placement. After the bone expansion is completed, use these 6 implant carriers together with our straight handpiece to manually insert the implant. These 6 implant carriers are compatible with most common implant systems on the market. The first one, NBA 223, corresponds to the narrow neck NP connection for Nobel Biocare. The second one, NBA 2.63, stands for the regular platform RP connection for Nobel Biocare. The third one, SDR 2.98, represents the RC connection for Straumann. Since the Straumann NC implants have a diameter of 3.3 millimeters, this size is rarely used in transdigimatic wing implant procedures. Therefore, for such surgeries, we typically use Straumann RC implants with a diameter of 4.1 millimeters or 4.8 millimeters. The fourth one is DN248, which is for the commonly used Dentium system. Dentium is one of our most frequently used systems for Dentium implants. The straight handpiece can be directly connected to the Dentio implant carrier. The fifth one, OSS 2.46, is the standard connection for Ostem. It fits Ostem implants with diameters of 4.0 millimeters, 4.5 millimeters, and 5.0 millimeters. However, this carrier cannot be used with mini implants due to its R-type connection. The sixth one, AB 2.41, is designed for Israeli implant systems. The connections among Israeli systems are mostly universal. So, this AB carrier is compatible with all our Israeli implant systems. in cases where the doctor's implant system is not among the ones mentioned above. We also have a universal adapter available. This is our universal adapter. One end of the adapter connects to the motorized implant carrier from the standard implant toolkit, and the other end connects to our straight handpiece included in the kit. Please note that when using the universal adapter, the torque should not be excessive. We generally recommend not exceeding 35 Nm, as excessive torque may cause deformation at the connection point between the adapter and the implant carrier. The universal adapter can also be used with the two motorized screwdrivers in our kit. The first wire is for Nobel Biocare, and the second one is for Straumann. They are designed to be directly connected to the implant handpiece when access angle is limited. In addition to the universal adapter, we also provide two extension adapters. One is the motorized extension adapter, which connects to the implant carrier on one end and the implant handpiece on the other. The other is the range extension adapter. If the implant carrier is relatively short, you can connect one end to the extension shaft. And use it with our straight handpiece. Now let's look at the tools in the lower compartment. First, the depth gauge. The head of the depth gauge has clear markings. In sequence, there are 7, 10, 13, 15, and 18 millimeters. Next are the 3 long drills for transygomatic surgery. The first one has a diameter of 2.0 millimeter. The second one has a diameter of 2.3 millimeters. The third one has a diameter of 2.8 millimeters. Each long drill has a total length of approximately 60 millimeters. There are also marks with scales ranging from 11 millimeters, 13 millimeters, 15 millimeters, 18 millimeters, 20 millimeters, 22 millimeters, all the way up to 25 millimeters, which fully meets the length requirements for transygomatic implant surgery. This completes the instruction for the Retect Dental Surgical Instrument Kit. Thank you for watching.